Hi, my name is Sarah. I'm a clinical pharmacist at the VA in Grand Island. I'm a pharmacist in the anticoagulation clinic here. This is a clinic that is specifically designed for the purpose of managing your new medication called coumadin, or warfarin. Your VA provider has asked me to help manage this medication, and I, as a pharmacist, specialize in making sure that you can safely take this medication. Coumadin, or warfarin, is a blood thinner that helps to prevent blood clots. Blood clots can cause things such as strokes or heart attacks, and so it's important that we keep your blood at an appropriate thinness in order to prevent these types of occurrences. You are on this medication because your VA provider has determined that you are at higher risk for a blood clot. It may be due to a heart condition such as atrial fibrillation, in which your heart doesn't beat correctly. It also may be that you've recently had a blood clot, or you've had surgery that puts you at higher risk for a blood clot. For whatever reason you are on coumadin, we welcome you here, and we will do everything we can to assure that you feel comfortable taking this medication. As you may know, coumadin is considered a high-risk medication, and so we monitor it more closely than we might some other medications, and we will continue to monitor you throughout the course of your treatment. A test called an INR is the test that we will use each time you visit us in the coumadin clinic. This test measures how thick or thin your blood is. Your goal for your INR is going to be either between the numbers 2 and 3, or your goal may be slightly higher at 2.5 to 3.5. In general, for the purpose of this video, I will refer to goal as being between 2 and 3, as this is the most common goal. If your blood is above 3, that could mean that your blood is thinner than it should be, and we may be at risk for some of the side effects of coumadin. If your blood result shows that you are below 2, that means that your blood could possibly be too thick, and hence you are at a higher risk for a blood clot at the moment. You should understand that a normal person who is not taking coumadin has an INR value of about 1 or 1.1, maybe even 1.2. And so when you take this medication, your blood is being thinner than normal in order to prevent your risk of blood clot. You should know that when you have your blood drawn for your INR, you do not need to be fasting, and you do not need to skip your morning medications before you come in. You should eat and drink and take medications as you normally would before you come in to have your blood drawn. There are some important questions that we will ask you every time you come into the VA anticoagulation clinic. And the information that I am about to provide for you will help you understand why we ask you these same questions each time you visit us. Some other things that you should know about coumadin include that you should take your tablet at the same time every day. You should not skip doses or double doses if you happen to forget. The most common side effect of coumadin is bruising or bleeding. You should know that as a person on coumadin, you will notice that you probably bruise a little bit more easily than others. You may also notice that if you cut yourself, it may take a little bit longer for the bleeding to stop. Let us know if you have any changes in your medications. There are many medications that interact with coumadin, as it's a very sensitive medication, and so each time you start, stop, or change a dose in a medication, it is absolutely pertinent that you let your coumadin pharmacist know. Also, if you decide to take any herbal products, you should know that many herbal supplements interact with coumadin as well, and we encourage you to ask your VA pharmacist before you begin one of these medications. If you are sick, ill, generally under the weather, or hospitalized for any reason at all, you should let us know. These things can affect the thickness or thinness of your blood, and so we may need to make adjustments to your medication. If you take an antibiotic for any reason whatsoever, please let the coumadin pharmacist know, Antibiotics are well known for interacting with your coumadin, and we may need to monitor you a little bit more closely. Your diet has an effect on the thickness or thinness of your blood as well. It is important that you know that foods that contain cranberry or grapefruit will interact with your coumadin. This doesn't mean that you can't eat cranberry or grapefruit products. It just means that you need to use them in moderation, or you need to be consistent about their usage, and we can adjust your coumadin dose around those foods. Green leafy vegetables are also a medication that will have an effect on your INR. Green leafy vegetables are full of vitamin K, and vitamin K works in the opposite way of coumadin. And so, if you eat more vitamin K foods than usual, we may notice that your INR starts to drop to a thicker level than we would like, or closer to 1, the normal value. Again, we know that getting your greens in each day is important, but what you should know is that you need to be consistent about your intake of green leafy vegetables. Please let us know if you have any signs or symptoms of a blood clot or a stroke. We hope that your coumadin will keep you from these medications, but because you are higher risk for a blood clot or stroke, it's important that you understand what signs and symptoms to watch for. I know that this may be overwhelming for you, and we hope that coumadin will help prevent these sorts of occurrences. But it is important that you be educated and aware of what types of things to watch for, as you are at higher risk for these diseases. Coumadin in general is an overwhelming medication, but the pharmacists in the anticoagulation clinic are here to help you in every way. We sincerely look forward to getting to know you better, and we want you to know that you can contact us at any time if you have a question. Don't be afraid of your coumadin. It's a wonderful medication, and it does its job very well. As long as we monitor you closely, everything should be okay. Good luck, and welcome to the VA Anticoagulation Clinic.